Thanks everyone for joining us for the PHIND seminar series this morning. We're excited to have you with us. Our upcoming PHIND seminars, one will be in May. It'll be Angela Zhang. And then we'll have another one in June by Allison Okamura. We'll slowly be transitioning to some of these as hybrid seminars as we start to get back to a little bit more normal operations. Also wanted to give a shout out, big congratulations to Dr. Gary Gold on being confirmed as chair of radiology. So, let's all give him a big round of applause. Very, very excited to continue to work with Gary on this, and also as acting and director of the PHIND Center. So with that, I'll turn it over to Dr. Gold to introduce our speaker for today.
Thank you so much, Ryan. So this morning, I'm delighted to introduce Liyue Shen, who's a PhD candidate in electrical engineering, who will be giving us a talk this morning on MRI of the fetal brain entitled Time Before Birth, a Look at Developing Human Brain. She is a final year PhD candidate in electrical engineering here at Stanford, co-advised by John Pauly and Liyue Shen. Her research focuses on the really super hot interdisciplinary field right now of medical AI to develop efficient AI machine learning driven computational algorithms and techniques for biomedical imaging and processing to address real world biomedical and healthcare problems. She's published papers in multiple conferences and medical journals, including Nature BME, IEEE Transactions of Medical Imaging, MedAI, and Scientific Reports. She was the recipient of the Stanford BioX Graduate Student Fellowship and was selected as a rising star in the EECS, MIT, and rising star in data science by the University of Chicago. She co-organized the Women in Machine Learning workshop at ICML in 2021 and the Machine Learning for Healthcare workshop at NeuroIPS in 2021. She received her master's degree from Stanford. Before that, she was conferred her bachelor's degree in electronic engineering from Tsinghua University. Liyue, thank you very much, and we're really excited to hear your talk.
Thank you so much, Professor Gold, for your kind introduction. And I really want to thank a lot again for inviting me for this seminar. I'm really happy to share our recent works with Christine on the fetal brain MRI project. So let me share my screen here. Okay, hope the slides is working now. So just one quick note. So I'm very happy to take any questions during the talk or after the talk. And since unfortunately the two main collaborators in our clinical side, Christine and Jimmy, they cannot attend this meeting now because the clinical task. So I will try to take all the questions, including the clinical ones, to my best of knowledge. But if there is anything that you want to specifically on the clinical people, I'm happy to connect and reach out offline as well. Okay, so let's get started. So this project is about to see how we can use the new technology to help us to better understand the human brain development, especially for the fetal brain. So starting from some general scope, in the recent years, especially at Stanford, we have seen a lot of impressive success that is achieved by the AI technology, which has really changed this field of the biomedicine and healthcare from different perspectives. And currently, for example, we have seen many exciting works that train the AI or machine learning models to help with the doctor's jobs in the medical or clinical task. For example, we have seen this classification model that is developed for the skin cancer diagnosis by Stanford people in 2016. And also we developed the AI model to segment the organs or tumors for patients' treatment in many different works. So this is a very exciting age that we have seen this new technology has bring some new opportunities for the medicine and health. So in general, especially with the recent years, the real-world challenges in biomedicine and healthcare, such as the COVID-19 pandemic and also the increasing cancer cases, we have seen all these kind of the challenges has been increased a lot over the past several years. And in order to address these challenges, we hope to use the technology such as the biomedical imaging or image processing to help us to understand the human health to a better level, and especially in the different levels as well. So for example, in the human level, we use the photographic images or the depth sensor data to help us to understand the human behaviors, such as this action recognition to help with the healthcare applications in the hospital. And also in the anatomy level, we use the biomedical imaging, such as the X-ray, CT, MRI. All of these are significant tools for us to visualize the internal structure of the living subject for the clinical disease diagnosis or the treatment therapy. And also, moreover, in the molecular level, we are also using the microscopy to understand to have a better understanding about the process of virus infection or help with the vaccine development. So all of these are some important tools or procedures that we use to understand the human health in the different levels. And motivated by the real-world challenges recently, we want to see many research in recent years has been focused on to develop efficient or the novel AI or machine learning models or techniques for biomedical imaging and image perception in the different levels for the real-world deployment. So in this talk, I will present one of our recent research works that is very interesting, which focus on to use the AI technology or develop the machine learning model to help with the doctor's clinical job. So when we think about how AI can be combined in this kind of pipeline to help with the doctor's clinical task. So in this kind of for example, the pipeline of the imaging systems, we could use the AI to help with the biomedical imaging to help us to obtain more advanced imaging or high quality images to visualize the internal structure of the living subjects like the human body. We could also use the AI technology to help us to extract the useful information from the image data by processing and understanding the image data in a different ways and can employ it later for the real-world applications or deployment. So in this project, we mainly focus on how we can use this kind of the technology to help us to extract the useful information from the images to help us to understand the image data in a more advanced way, and also to help with the clinical task. So this work is also very interesting because of the close collaborations between the engineering people and clinical people for this collaborative project. So for firstly, before getting to more technical details, I would like to first give some brief background about this kind of the project on the fetal brain MRI. So for example, we have known that the normal human brains, the development of the human brains is always undergoing the rapid structural and functional changes in the utero. So we can see that from this example, the fetal brains will have this kind of the different features or change in the appearance that is along with the different weeks or in the developmental trajectory of the fetal brain. And the MRI is a very robust imaging tool that can offer this insight into this changing appearance of the developing human brain, as we can show in here. And especially in one of the standard tasks for the clinicians or the radiologists is to observe that if there is any feature deviation from the fetal MRI images to help to decide or determine that if this fetal is growing on a normal trajectory or if there is any abnormality. So for example, as shown in the example in the right figure, so if the radiologist observe this kind of the different features that is deviate from the normal brain development based on this kind of, for example, the fetal brain MRI images. So it always provides some clue or evidence, for example, for the brain developmental aberration or the congenital brain anomalies. So this just showing our motivation, where it's also one of the standard clinical tasks in the pediatric radiologist to see that how we can use the MRI as some evidence or feature for us to develop, for us to detect the abnormality, the potential abnormality in the fetal brain development. So that is how the clinical people is doing in the current protocol. And in order to make this kind of the task can be completed by a more advanced tool or in a more automatic way. So here we want to propose this kind of the model to help us to see that if we could predict the fetal brain age based on the features in the MRI images, and then use this as some evidence or clue for us to see that if we could detect the potential anomalies from this kind of the systems for the disease diagnostic classification. So specifically, what we want to do here is that based on the given MRI images, we want to predict the fetal age based on this kind of quantitative image perceptions from the image features. And then by comparing this kind of the predicted ages from the images with the gestational ages, that should be the correct one in the standard fetal brain development trajectory. We will see that if this fetal brain is undergoing the normal trajectory, or if there may be some potential anomaly that is happening. So this is the general idea also used by the clinical people like Christine in their clinical protocol to see that if there is any abnormality that happening in this kind of the patient cases. So with this kind of the goal for the age prediction based on the image features, we want to see in the technical part, how can we achieve this goal, or what kind of the specific algorithms or models that we could design to achieve this kind of the goal. So based on this idea, and also with the recent progress we have seen in the machine learning or deep learning for the image recognition, we want to see that if this kind of learning-based model can give us a way to mimic the clinician's behavior to help us to understand better by extracting the information from the MRI images for the quantitative perception of the fetal brain age prediction. So in this project, the main goal is to develop this kind of the machine learning model that can help us with the quantitative perception of the fetal brain MRI images to predict the fetal brain age from the image-based features. So this is more like in the technical part that what we want to do here in order to serve as a fundamental or evidence for the abnormal detection. So with this kind of the motivation and goal, when we look into the fetal brain MRI images, we actually realize that it is very different and also very challenging task compared with the adult images. So if we think about the adult brain MRI images, it always looks pretty standard with the brain structures, and also have been well established in this kind of MRI brain scanning. But if we look at the fetal brain MRI images, there are some very unique and also very difficult challenges when we're dealing with this kind of specific and special image modalities. So for example, if we look at the example that's shown in the right figure, we see that given this kind of the fetal movement in utero, there are some variable and also unpredictable fetal positions that will happen during the scanning of the fetal brain MRI. And also the fetal brain images is always heterogeneous in the location and also the orientation during the MRI scanning. So from these examples, we see that how challenging it might be to recognize or to extract the useful features exactly from the fetal brain, because we have seen that there are some random motion, there are also some background noise. So beyond, for example, like the maternal structures and also the other long brain fetal structures in the background. So how can we filter out the influence of this kind of the random motion and also the background noise, and can more precisely to extract the useful features from the fetal brain to help us to predict the age based on the image features. So that is actually a very challenging task when we look into this kind of the specific modality for the fetal brain MRI. So after realize this kind of challenging, and also in order to better address this kind of the challenging to achieve our goal. So in this project, we propose this kind of the machine learning model, especially based on the attention guidance or the self-attention learning that hope to automatically and adaptively suppresses the background noise, and also in order to localize the fetal brain. So how can we do this? So this is the whole and also the general framework that we proposed to do this kind of task. So it may be a little bit complicated. So I will split in multiple modules to explain this in different steps. So firstly, we firstly set up this kind of the standard deep learning model or CNN model. Actually, it is what we are using to extract the features from the whole MRI images of the fetal brain, and hopefully to learn the regression task that how can we get this kind of the quantitative perception based on the image features to predict the age of the fetal brain based on the features that we have seen or the model have seen in the future. So this is what we call the global branch, where we do the image perception on the entire MRI image. And then, as we just mentioned, there may be some mistakes or there may be some distraction when we do this kind of image recognition, because the fetal brain is only cover a sub-region among the whole scan, and there are also other background noise and also the other non-brain structures or the maternal structures that may distract the image perception. This can also be recognized when we look into the attention model. So when we extract the attention map from the last layer or the last block of the global branch model, we have seen that the model can somehow roughly capture some features of the fetal brain region among the whole scan, but there are also some distraction from the background. And also we want to see that if we can have a more accurate or precise model that could emphasize more attention on the specific subregion of the fetal brain for us to learn more specific or accurate features from the brain structures instead of the other structures. So with this kind of the motivation in the whole framework, we propose this kind of the self-attention soft weighting, where we extract the attention map from the global branch, and then with this kind of the additional Gaussian mask to emphasize that we know that the fetal brain should always have a higher probability to appear in the center region of the whole scan. And with this kind of the differential process, we construct this soft weighting attention mask, which is actually a soft weighting, a soft mask. So it's not a binary one, but we want to use this kind of the soft weighted to emphasize onto the original whole scan for the entire MRI to automatically and adaptively suppresses the background noise and also the other signals or the other structures in order to localize the fetal brain region. So that is how we are doing here for this attention guidance or mechanisms, which is what we call as the self-attention learning or the soft weighting. And then after this, we add this kind of the soft weight mask back to the entire MRI scan of the fetal brain in order to emphasize or add more attention on the local region of the fetal brain, and then use this as the input to a local branch where we set up as another parallel branch to extract the information or the structure or the features exactly from the fetal brain region, and to extract more accurate information and for the regression task for the age prediction. So finally, we construct this kind of model by combining the features or the information from both branches, including the global branch and the local branch, for our final task for the age prediction, based on the image features from the fetal MRI image. So this is how we proposed this kind of the mechanisms or the framework, especially to dealing with the random noise and also the random background signals in the fetal brain MRI images. And especially in the intermediate stages, this kind of the self-attention mechanisms or the learning structure is actually differentiable. So which means that we train the entire model end to end, including to training how to extract this kind of attention mechanisms and then add it back to the whole scan with this kind of the differentiable self-attention mechanisms, we can train this kind of the framework as an entire model to get our final to get a final outcome or output for the age prediction. And another thing to note is that here we do not have any other bounding boxes or the manual labeling on the region of the fetal brain, because that will also require very expensive and time-consuming labeling work from the medical or clinical people. So here we only use it as a weak supervision based on the fetal brain age, and depending on this kind of the localization or the attention based on the self-attention learning with the weak supervision. So this is how, in the technical part, how we structure this machine learning model to help us to better extract the features from the fetal brain MRI images for the age prediction for the regression task. So this is mostly about the algorithms. And after with this kind of the method, we want to see that how this method can work in the real clinical data, especially for this kind of the fetal brain task, as we just mentioned in the first part. So in order to do this, we find that it's very hard to find any public data sets from the community because of this kind of the special and unique data modalities, and also the pretty rare data for the fetal brain MRIs. So in this way, we firstly collect the data from the Stanford cohort. It's actually from the Stanford Children's Hospital. So with this kind of the a lot of efforts and works from the collaborators in the medical schools, we collect the Stanford data sets, which in total including the 741 samples from multiple years. And in this one, in this kind of the fetal brain MRI images, we also show this kind of the different parameters that is used as a summary to describe the general attributes or the characteristics of the data that we collected from the Stanford Children's Hospital. And more interesting thing is that we are really happy to announce that this data set is actually currently publicly available at this kind of the Stanford Digital Respiratory, where after we publish our paper upon the acceptance. So I will hope this kind of the data set could further contribute to the research in this line in the research community and to our best knowledge. This is also currently the largest public data sets in the fetal brain MRI images, which is also open source. So yeah, we're very happy for other people to share with this data for the other collaborators and across the different institutions. And yeah, please feel free to check it. And if there is any questions, and also feel free to reach out to us about the question about the specific data problems. And and after we collect this data, we have done this we have applied our model and also trained our model on the Stanford dataset, and to also see that what kind of performance it can be conducted on the Stanford dataset. So in general, the results on the Stanford dataset is pretty encouraging. So firstly, we get a pretty accurate age predictions with the metrics like the R2 score and especially the mean absolute errors. So which means that the average errors that we predicted on this kind of the data that we collected from the Stanford clinical protocol, with this kind of the average errors that is less than 1 week, which is 6.7 days. So I think this is very encouraging because this can give us to see that how accurate the model can predict for the fetal brain age based on the features from the images that we have seen. So this is actually to mimic what the clinical people, the pediatric radiologist is doing in their clinical job. And then beyond this kind of the metrics, we also have done a more comprehensive application study to see that how actually our model can work with the different parts or the different influential factors. For example, we have tried the different important factors in our experiments, including the different planes and also the different number of slices. So firstly, for the different planes, we have seen that in the MR images, we can use the orientation of the images or the cross-sectional slices at a different orientation for us to understand the fetal structure to extract the information. But in our experiments, we find that if we could get the comprehensive information from multiple planes by combining the multiple model together for the feature extraction, that could give us the best results to get the more accurate information for the edge prediction. That also can match our intuition in this task. And also another interesting thing to share is the number of the slices. So because of the limited of the data, here we are doing this kind of the 2D, we use the 2D network or 2D CNN, or actually the 2.5D, which means that we're trying to find the middle slice of the fetal brain, which is the most typical or the representative of the features of the fetal brain for the edge prediction for the regression task. And in order to see that if we should include more information, we also add the neighborhood slices, which is close to the middle slice of the fetal brain, in order to give more information. But the interesting thing is that we find it doesn't always mean that more slices will give us better results as always. So this is also corresponding to the challenges that we mentioned earlier in the fetal brain MRI images, which means that if you include more slices, there are also more background or the more noise or the other structures that could be included in your input data that may distract or influence the model performance. So in this way, we find that in our final model, the 3 slices, which means that we have the center slice and also the other 2 closing slices, which is neighborhood to the center slice, that can give us the best performance in this kind of the regression task. And so in the summary, we find that if we can use the multi-plane at the attention mechanism and also use multiple slices, all of this can help us to add more accurate information to get a better performance to the edge prediction and serve as the abnormal detections in a clinical task. So this is what we have to this kind of the quantitative evaluation using the different metrics to evaluate our model on the Stanford dataset. And beyond this kind of the accuracy or the performance on the edge prediction, so another interesting thing is that how our model, how the attention mechanism can really work for the localization. So here we show some examples in the different orientation plane and also with the attention map that we collected from the global branch. And then the final column is what we finally learned through the whole framework in this kind of end-to-end training, and what's the final attention model or attention mask that we learned to extract, to filter out the influence or the distraction from the background noise, and also the other structures that can have a more accurate localization for the fetal brain region. And especially to note that here we do not have any localization annotation such as the bounding boxes or the contour of the fetal brain in the whole scan that is notated by the manual people. But actually we use only the weak supervision, that is the edge of the fetal brain, to train the whole model or the whole framework end to end. And this can also help us to have a more accurate attention learning to see that where is the localized region for the fetal brain. So that is what we have observed in the Stanford dataset, including the accurate edge prediction, as well as this kind of pretty reasonable localization on the fetal brain with the weak supervision. And beyond this, after we achieve all these results on the Stanford dataset, we also have conducted a more interesting study for the multi-center or cross-institution validation. So as always, we can see that we developed this model on the Stanford dataset, and we also always want to see that how our model can be useful or can be deployed to the other center or to the other institutions. So in this way, it's very challenging because we need to have this kind of the collaboration and set up the collaboration and also have the data sharing from the different centers. But it's also very meaningful because this is what we want to achieve for the clinical or for the real world deployment. So based on this kind of motivation, for the later part of this project, we firstly start this kind of the collaborations across the multiple centers, especially want to see that how our developed model can be deployed to the different centers. So for example, in the first step, we collected this kind of the data based on the international collaborations from the 4 clinical centers in the US and also another international centers in Turkey. And also the figures in the right side shows the examples from the different cohorts of all the different centers, along with the different numbers of the data that we could collect it from the different medical centers. And the interesting thing is that from this kind of a different cohort of the different centers, the data or the image characteristics are actually very different. So that could be observed not only from the image, but also from all the parameters that we have known for this kind of multi-center data set. So from this table, we have this kind of the summary about the different attributes or the parameters that is used for the different center when collecting this kind of the fetal brain MRI images. So firstly, we have seen that this data set definitely includes the data from the different vendors or different scanners, including the GE, Philips, and Siemens. So as we see that our model, which is developed and also trained on Stanford Dataset, is mostly on the GE scanner, while in the other centers or the institutions, they are also using the very different systems from the different vendors. And also besides of this kind of the different data populations or the patient's cohort, the technical and also protocol parameters are also very different. So regarding to the different clinical protocol that is used to collect this data. So all of this have showing the different characteristics of the attributes for the multi-center data set, which is also actually the realistic scenarios that we are facing in the real world deployment, where for the different institutes, this kind of variance always exists for the not only for the fetal MRI images, but also for the other clinical data modalities as well. So this is also what we one of the significant motivation for us to think about how our model can be deployed for the clinical practice in the real world. So the results on this kind of the cross-institute validation is very interesting. So we are showing this kind of the results in the table as shown here. So firstly, the model that we developed is trained on the Stanford dataset, as we have already mentioned. So the results before the fine-tuning actually showed the results. How does it work if we just deploy the Stanford trained dataset directly on the other centers data? So this is directly showing that how the model is performed in the different cohorts, especially also considering this kind of different technical parameters or the data from the different vendors. And then we think that because this kind of the variance across the different data or different cohort, it may be useful or very necessary for us or for the model to have seen some few examples from this kind of the new cohort, and how does this can maybe have a better performance on this kind of the new patients cohort or the new data set. So as what the other works also have been doing here, when journalized to the different institutions or the different centers, we conduct the fine-tuning on our model, which is trained on Stanford dataset, to the other clinical centers. And also another thing that we want to note here is that even though we are doing the fine-tuning here, but actually because of this kind of the uniqueness of the fetal brain MRI data modalities, so actually we are not able to collect a very large-scale data set from all the other hospitals or clinical centers. So in this way, we only use the 20% of the total amount of the data that we collected from each center for the fine-tuning. So that is only in quite a few samples. For example, in this SJH data that we collected from one institute, in total there is only 25 samples. So which means that we only use around 5 samples for the fine-tuning. So this is quite a few data that the model could see in the new cohort for the fine-tuning stage. But even with this kind of the small data that could be used for the fine-tuning, the model have also shown quite decent improvement with this kind of the fine-tuning procedure, and also especially how this can be used for the different data, including the different models that were development, including like the single slice model and also the multi-slice model in the 2.5D. And we also see that how this kind of the model can be generalized to the different centers after a simple fine-tuning stage with a crowd of with a small set of the new data from this kind of new centers or new cohort. So although this kind of different data sets have this kind of different characteristics or the patient's cohort, the results also show pretty decent generalization and robustness for the development model. It also demonstrates the potential possibility for the real-world deployment, especially for the small medical centers, for example, in the developing country, where there is not efficient large-scale data for each center to develop their own machine learning model for the automatic tool. But also, but we can use the model that we developed on the other large medical centers like Stanford Hospital to generalize to the other centers to further fine-tune or customize it to their own model. So I think that is a more practical and realistic setting for the clinical or the real-world deployment. So this is what we have studied for the cross-institute validation in this project as well. So finally, I want to give a quick summary about this project that we have done in this work. So firstly, from the AI or machine learning community or side, here we develop this kind of self-attention learning model, especially with the motivation to adapt to the complex dynamics features or the unique characteristics of the biomedical imaging, such as in the fetal MRI, we have this kind of the random motion orientation and also the background noise. And for the community in the medical analysis, here we show that it's possible to do this kind of accurate and also faster inference for the quantitative image perception to predict the fetal brain ages based on the features for the brain MRI images. And finally, in general, also the final, the original motivation for us to study in this project is to show the real world impact in the clinical disease diagnosis. So firstly, we have seen that we can develop this kind of the automatic tool, including the self-attention learning, that can streamline the challenging diagnostic classification task for the disease diagnosis, and also for the abnormal detections, as we have mentioned in the introduction level. And also we show that our model can generalize across multiple medical centers across the world with this kind of the cross-institute validation from multiple medical centers. And finally, upon this kind of application, we also release our data set and also model to the public community to further improve the collaborations across the different institutions in this kind of the community. And especially because there haven't been many public data sets in this kind of more specific modality of the fetal brain MRI. We hope this kind of the contribution in the data set can also be one of the starting point for more researchers to study in this kind of the significant problem that can further help to improve the model, improve the technology in this part. So this is how we see that this kind of project can contribute to the different communities with the different perspective. And finally, just to get back to the message that I deliver in the introduction part, we hope that this kind of the technology based on the AI or machine learning can further to help us to understand the human health in different levels. So to help with the doctors, to help with the human life, and also help with the scientific discovery. So I think that is the goal for many people who are working on this kind of the interdisciplinary research areas, and also what I want to do in my future research direction. And finally, I want to thank you for our advisor, the Christine Young, who is the main leading person for this to give the advice for this project, and also especially the collaborators from all the clinical people, including the Stanford Hospital and also all the other collaborations that when we are doing the multi-institute validation in the different medical centers. And also, I want to thank you especially for our funding support from the PHIND Grant Award, the Phoenix Healthcare, and also the Stanford Graduate Fellowship. So if there is any question that you want to discuss for the technical part, for the method, or for the data collection, we are very happy to answer more questions about it. And feel free to reach out to me through my email if you want to chat more offline. So thank you so much again.
Great, thanks for a really excellent talk and really great progress towards this project.
Thank you.
Yeah, so please, either raise your hand as some of you already are, or go ahead and write your questions in the Q&A. Daniel, looks like you have a question. Please go ahead.
It's very exciting work. How accurate can you determine the ground truth gestational age? And does that vary in the ability from center to center? Because I would think that centers that had fewer imaging studies would probably not be as good at determining that ground truth.
I see. Yeah, that's a pretty great question. So this is also what we have discussed for many times with the clinical people. So firstly, I'm not an expert in that way. So again, yeah, I will definitely to answer this question to my best of knowledge. So what we are doing here is that we get this kind of the ground truth from the ultrasound scanning of the gestational age that has been conducted in the protocol for this kind of patient cases. So which is more like how many like the weeks has been this kind of the fetal has been developed in utero. So honestly, this kind of the data or the ground truth data is determined by our medical collaborations like Christine from the reports that they can have along with these patient cases. I totally agree with you, especially for the multi-center data. There may be different kind of the procedure regarding to this kind of determination or the decision on this, even though we have the ultrasound data or report that is corresponding to these patient cases. But in that way, we still rely on this kind of the data as our ground truth, especially considering like our motivation. We want to mimic the behavior that clinical people or the radiologist is doing. So I think to the best of knowledge of the radiologist, what they're doing is also to compare the image with regarding to some specific examples or template that they have, which means that how does the fetal brain should look like, for example, in the 10 weeks. And if it is actually look like the example or the template that we have, or if there is any features that is deviate from this trajectory. So in order to mimic this kind of procedure, we also develop this kind of automatic tool or the systems based on all the features that we have from the images. So regarding for the ground truth, we also use the normal fetal data that we have in our training data set. So that may be more reasonable regarding to this kind of the matching between the image features and the ground truth feature ground truth edges we have. But for the abnormal cases, I agree that will be an even more challenging thing to decide in the clinical part as well. So yeah, I think that may still remain some open questions, especially regarding the future research direction in this project. But I think it's, yeah, it will be very interesting if you're interested to check this together with, for example, like Christine, who is leading this part. So I think that will be very interesting to see that if this model can even maybe do further in this kind of ground truth determination based on the image features we have.
And I'm sure there must be some variation in the development and fetal development that's not abnormal. Yeah. I don't think every fetus brain develops like clockwork the same. It may be a factor of a lot of maternal issues, obesity, diabetes, etc. Baby size,
that's true.
All these things may cause variation. Very exciting work. Thank you.
Yeah, thank you so much.
Let's see, we have another question in the chat. It says, I remember that the brain locating yes, please.
Yeah. So I think regarding for the question about the ground truth, one of our collaborator, the Professor Halabi, actually just raised some comments in the chat. So yeah, that's great. Yeah, thank you so much for sharing this. Yeah, so there are definitely different maybe different variants for the different institution and the cohorts. Yeah. Okay. Thank you. And yeah, I see there is another question in the Q&A. Oh yeah, right. So thank you so much for the question. And what I mentioned about the weak supervision is actually what you mentioned here. So we only have the gestational age that is as our supervision to train the model, train the health model end to end. And we do not have the the exactly like the bounding boxes or the regions for the local region of the human of the fetal brain to train this kind of localization model. So this is what we call is more like a self-attention learning mechanism that will help us to suppress the background. But yeah, this is why we call it as a weak supervision. Yeah. Does that answer the question? Okay, thank you. Okay, I see another question in the chat. Could you comment about how the future machine learning algorithms may help you on this project or directions? Oh, for sure. Yeah, thank you so much for asking this. Yeah, this is actually a very interesting question, and also what I want to raise. Also, one of our motivation to publicize this data set in the community as well. So we definitely think our model is not to say that we have solved this problem totally. So we just open this kind of door and also hope to have more people, more researchers to study in this direction. So there are many different directions to go with maybe in the future. I could mention some that we are thinking about now, but there are definitely more possibilities that could happen. So for example, regarding to the technical part in the machine learning algorithms, here we propose the self-attention mechanisms that is based on the attention map and also the Gaussian mask based on our heuristics knowledge and also with the soft weighting. So this is also more on our heuristics about how the radiologist is to look at the images and to localize the fetal brains. But if we considering the attention mechanisms, I think there are much more advanced algorithms in the deep learning or machine learning. For example, the transformer based on the attention mechanism that could have the non-local mechanisms or the correlations that may also further help to have a better recognition or extract the better features from the images. And also from the other side, I think to considering how to develop the model that could generalize better across the different centers or different institutes is also important. So for example, as you see that even though the fine-tuning can help quite a lot on the performance or the behavior in the other centers, but generally it still decrease, the performance still decrease compared to the Stanford data that we have. So which means that we are still trying to overcome this kind of gap between the with the variance from the different centers in the data cohort. So for example, how to make this kind of machine learning model can be more generalizable and more robustness when compared with, for example, the different distribution or the different patient cohorts and also the different data characteristics from the different vendors. I think that is very important regarding the real world deployment. And moreover, is that as we see that for some clinical centers, there are just a very few or very small data set that we could use. So which means that we do not have much data from this kind of centers, no matter it's from what kind of the vendors. So in this kind of thing, if we can have more data efficient way to leverage this kind of the small data set to help us to overcome this kind of this kind of gap between the different data cohort. I think that is also very important, how to have like the data efficient learning. That is also very important a thing if we want to solve this kind of problem, especially across the generalization across the multiple centers better. So yeah, so in summary, I think to have a better like attention mechanisms in the machine learning model to have a more generalizable and robustness across the different data set, and also to have more data efficient learning regarding to the limitation of the data in the collection that we have. I think all of these are very important questions and also directions that could go in the future for this project. And we also hope the public size of this data set could motivate more, also could give access to more researchers that could have the interest to continue research in this direction. So yeah, that's just what I am thinking at this time point. But yeah, definitely the different people will have different ideas. So I think generally for the future the improvement in this project or in the machine learning algorithms, I think there are many different answers and also different opportunities, possibilities that is open. Thank you.
Well, Daniel, go ahead if you have another question, please.
Developed the same way. I think that these parameters such as fetal weight may have a role. Maternal weight, worried about diabetes, we're seeing more diabetics. And so I think when you have such a large database accumulating, you may want to take a look at whether any of these parameters affect the gestational correlation, gestational age correlations.
I see. Yeah, that's a very great comment. Yeah, definitely.
Rather than assuming they're all together, I'm sure you're averaging it all out, but you may find that maternal weight or fetal weight has a role in the developmental predictions.
Yeah, that definitely makes sense. Yeah, and also I think the abnormal detection that we are trying to achieve here is also some the other abnormal disease that that could show the features in the images that is deviate from the normal trajectory. So for example, I think Christine also mentioned something like this. So if there are some other gestational ages or the abnormal things that could not make a difference in the features of the fetal brain in the appearance, so that couldn't be diagnosed or recognized by this kind of the pipeline with the age prediction on the image features. So I totally agree that regarding for the realistic settings, there are many diseases, there are many parameters. Yeah, that will be actually more complicated than what we assume here. I think we start this kind of the project, which was just to showing at the starting point that, okay, it's possible to have this kind of automatic tool that could show some interesting and also helpful information. But this may not be the perfect answer at the end of the day. So we're still doing more research in this line and also hope more people could contribute in this way, especially considering the complicated situation or scenarios in the real world deployment, like you mentioned, the different disease, that different parameters that will play a difference in the different aspect. I think all of these are very interesting questions that could be further investigated, along this line.
And you're raising very complex ethical issues if you start detecting abnormal. When do you tell the patient? When is it clinically important? When do you consider abortion? Very complex. I'm sure the Human Subjects Committee has a lot to do with what you inform the patient that participates in these trials, because I don't think there are simple answers. You may be finding things that we wouldn't know until a term birth. You may find abnormalities early that could compromise the fetus. And so I don't know how you're dealing with those. Are the patients being told that their fetal development is normal or off by, I don't know how you're handling that.
Oh yeah, so actually, I'm not sure if this is confusing, but I should emphasize this. We are not doing a clinical trial, so this is the retrospective study. So we are
you're getting information that has clinical relevance, and if you saw a hydrocephalic development would you do something? If you saw a grossly abnormal developing fetal brain, how would you handle that?
Yeah, so I think for this project, we want to propose this kind of automated tool that is to help with the doctor's jobs like the radiologist is doing, right? So when the radiologist is finding some abnormal things, what we'll do as the next step for their further diagnosis or the treatment, right? So that is what they have in their clinical protocols, but we're not handling that part. So what we want to do is to, for the first part in the diagnostic, that to help with the doctor to better see that if there is any features that is deviate from the normal trajectory. And after that, I think, yeah, it will just follow what the doctor is doing in the current protocol. For example, if there is no, not any automatic tools, if the radiologist finding this kind of the deviation features or something, what will they do? I think this may, I'm not sure, I'm not an expert in this way, but I imagine that this may be relevant to the different disease or for what kind of the treatment should be included, right, as the next step. But we didn't get into that part, but mostly on to extract the information from the image.
I mean, these issues came up with the baseline studies that the Canary Foundation were, and your department was involved in. And what do you tell people if you find abnormalities? And I don't think there's a simple answer.
Yeah, for sure. I don't think this is something that I could answer even, because
I think it's something that has to be considered. I mean,
yeah, for sure. Yeah, so I think generally to make this real embedded in the clinical protocol, there is a lot of ethic issues and also the considerations that will be seriously taken into consideration. So especially regarding to what's the standard protocol in the clinical nowadays for the people to make this decision for the following treatment. I think I would not say what's my answer because I do not have idea about this part, but I think it will be interesting if you would like to further discussion with our clinical experts like Christine. So I think we could have have some discussion on that offline as well.
Thank you.
Yeah, thank you.
Well, excellent. Well, thanks so much for an excellent presentation and for great discussion. Looks like there's a lot of interest, and I think there'll be a lot of people utilizing what you're creating. So thanks so much for sharing that with us today.
Yeah, thank you so much for inviting me for the seminar. And also, as I mentioned, if there is any other question and want to discuss offline, feel free to reach out to me and also our collaborators as well. Thanks.
All right, everyone have a great day.
Thank you.